Today we're here to talk about a revolutionary new product introduced to you by Stryker Medical in partnership with the Michael Graves Design Group. This new product is Prime TC, a transport chair. This product revolutionizes the wheelchair industry in an acute hospital setting. In our research, we noticed that the current wheelchairs today are not ergonomic, which is unsafe for the healthcare provider. They're not safe for the patient. And also, they don't lend themselves to cleanability, easy cleanability, which doesn't prevent spreading infection throughout a hospital. First and foremost, the push handles. I'm about 6 foot tall, and my hands are in a proper ergonomic position, elbows at 90 degrees, and with the independent push handles, it gives the mobility, maneuverability that you need to push a patient down the hall. Moving down the back of the transport chair, we noticed that the current braking system on a wheelchair is a friction lever. You have to reach and bend over and push a lever. Everything else in the medical industry is a one-touch brake. And that's what we wanted to transfer onto this product, is now you simply have a one-touch brake. That's your brake, and then to go, you simply do that. You reduce the bending, and you know that once you hit that brake, this chair is safe and secure. Now I'd like to move to the front of the chair and discuss the benefits for a patient. One of the things I want to first bring your attention to is hand position. You'll notice that I already have contact with the chair. What this does is give confidence to the patient as they sit and stand up in the chair. As I sit down, it's nice and easy. I always had contact with the chair. And as I get out, I'm able to scoot up for physical therapy. This is very important. Nose over toes. It gives you a nice center of gravity. And you can post and stand up nice and easy. Again, always having contact with the chair. These are called our stand assist armrest. The other great design about this chair is our footrest. Currently, the wheelchairs today, they don't get out of the way, and people aren't bending down to move them out of the way. So what we've done is made them spring loaded. So you'll notice that when there's pressure on this footrest, they'll stay down. When they pop up, it's easy and clear open access for ingress and egress of patients getting in out of the chair. It's nothing that they have to step over. We didn't want nurses to have to bend down to put this or hold this down into position, so they can simply use the foot lever here and put it down for the patient. The armrests completely fold out of the way, and this allows for easy patient transfer. Patient transfer from a chair to a bed, a chair to a stretcher, or a chair to an MRI table. We decided to take things a step further, and you'll notice that the yellow buttons on the bottom here, anything yellow on this chair is an activation point. You hit these, and they completely swing away. So what this does is give full access for your healthcare provider to address their patient and move them to other pieces of medical equipment. This also allows for chairs to be brought up close to tables so that patients can eat and really feel comfortable and dignified while in a medical environment. We have an IV pole and an IV topper that are very safe to use. This circular design makes it so that none of the typical hooks would poke somebody in the eye. So it's extremely safe when you're hanging something on this wheelchair. We have a chart holder that's extremely durable and it's easy to clean. Currently on a wheelchair today, it's a vinyl satchel, and it's extremely hard to get into and clean, and a lot of times it's something that's forgotten. For your O2 tank, which is very typical in this industry, we typically see a bucket design where you have to pick up an O2 tank about shoulder height and drop it down into a bucket. That's extremely hard to do when those tanks full are 30 pounds. So when you do that repetitively, it becomes an extra and added strain to the nurse's body. So what we've done is made a simple flip design here, and now you only have to pick the bottle up about 10 inches, you put the bottle in, and you simply close it. A little bit more about the chair and the aesthetics. If you look at it in the position it's in right now, we also feel that rather than having to store these in a particular closet or hallway or corner, it can be left out for not only patients to use, but visiting patients or other people in the medical environment that are walking around the hospital at the time, so it can be used as a regular chair. It's not something that you have to hide and put away. Last but not least is the infection control. Everything on this chair is polyurethane dipped, so your handles are dipped, your armrests are dipped. The seat back and bottom are all plastic and lend itself to that easy cleanability. Today we're here to talk about a revolutionary new product introduced to you by Stryker Medical in partnership with the Michael Graves Design Group. This new product is Prime TC, a transport chair. This product revolutionizes the wheelchair industry in an acute hospital setting. In our research, we noticed that the current wheelchairs today are not ergonomic, which is unsafe for the healthcare provider. They're not safe for the patient, and